So one common injectable misconception in the cosmetic world has to do with neuromodulators, and specifically Botox versus Dysport. I think that it's a little bit confusing as to which product is best, which product is going to work well for that individual patient. Although there are small variations between the two products in terms of the active ingredient, they do tend to work very, very similarly. As like other medications and other things that we put in our body, people can have individualized responses to each one of those neuromodulators. And so some people will have a better response with Botox versus a better response with Dysport. In general, the two products should really work pretty similarly though. What we expect for the average patient with each one of these injectables is that you should get about 3 to 4 months of activity out of that injectable. So 3 to 4 months where we're really treating those lines and wrinkles. One other sort of, not necessarily misconception, but something that a lot of people don't realize is that it's going to last beyond the 3 to 4 months, because during that time you're preventing the wrinkles from forming. And so you're actually doing yourself a favor and a service for years down the road, years to come. There is one minor difference that I've observed between the two products in my practice, and that is that Dysport actually will work it'll kick in a little bit quicker, a little sooner than with the Botox. So typically we expect that with Dysport you're going to see some of that action kicking in about 2 to 3 days, versus Botox, usually it's a little bit longer, maybe 3 to 5 days. They both should last about 3 to 4 months approximately. When Dysport launched, one of the big things, one of the big troubles with the product was that the dilution that was recommended was creating a lot of spread of the product. And so since that time, the dilution recommendations have been modified. And really most of these patients were treating this with the same or similar dilution between Dysport and Botox, and you're not seeing those spread issues that originally occurred. And so when you're carrying this product in a saline solution, if you're diluting it too much, it can go to other muscles, other areas of the face that we don't necessarily want to treat. And so that's a big problem, or was a big problem, that's really sort of been solved and improved at this point. So we don't worry as much